is Bailey Rogers, and my group is doing sedative hypnotics in college freshmen. What are sedative hypnotics? One of the most misused and abused drugs amongst college students. Sedatives can treat things such as anxiety. They can calm a person down and decrease activity, slow brain activity. A quote from ncbi.gov says, sedatives are abused for euphoric effects, which may have dangerous consequences. Hypnotics are mainly drugs that are used to help people fall asleep. They facilitate drowsiness. Abuse can cause slurred speech, coordination issues, and more. The primary level of prevention is what I'm doing. So what is the primary level? Well, it is preventing addiction or abuse of sedative hypnotics before it occurs. And so how do you prevent it? You inform more college freshmen about the dangers of harmless drug use and experimentation. Many colleges have implemented drug awareness and prevention programs in their schools to alleviate drug use among students. What do universities do as primary prevention? Well, most campuses are known as dry campuses, meaning if a student is of legal age, they are still not allowed to drink or have alcohol on campus. Campuses state that they are drug-free unless a student has prescription drugs, and they can be smoke-free and tobacco-free. And all of this is done to prevent the potential for drug use and abuse on campus for all students. And these will be posted on the school website. And for the primary level of prevention, our age group is freshmen, college freshmen, so age range like 18 to 20. Prevention programs. Many college campuses have implemented a drug prevention program sponsored by the DEA or the Drug Enforcement Administration to prevent drug use amongst college students. Prevention with a Purpose was intended to deflect from the college party environment and focus on how college students can have better academic experiences without using drugs. This program is not 100% effective, but the DEA puts their best efforts into drug programming to reduce drug use in college students. And this video that I put on this slide is from Prevention with a Purpose.
Hi, my name is Camille Schreier, and I'm Miss America. Your job working to prevent drug misuse among college students is needed now more than ever. DEA is committed to promoting the importance of prevention and its role in helping ensure the health and safety of our nation's colleges and universities. Resources like the Prevention Profiles Take 5 podcast, where I was a guest, give up-to-date information on drug laws, articles featuring top prevention leaders, publications, and more to give you the tools you need to be successful. Go to campusdrugprevention.gov to learn more. Hi, my name is Camille Schreier.
How many college students have tried drugs? USA Today publishes that half of the 5.4 million full-time college students in America admit to binge drinking or using drugs at least once a month, and that is from Dual Diagnosis. Nearly 2.0 million full-time college students, or 22% of college students, used an illicit drug in the past month, and that is from the Substance Use Report in College Kids using the National Survey of Drug Use and Health. The Journal of Drug Issues stated that over half of all college students and young adults have tried an illicit drug at least once in their lifetime. So from all of the bullet points above, there are quotes and facts from research done over college students who have tried drugs at least once their freshman year. This is a problem since not all of the students became addicted after their first time, but they open the doors leading to addiction, possibly in the future. Prevention programs can aid to prevent addiction or prevent students from even trying drugs in the first place if the programs are thorough and warn about the harm that drugs can cause to the student's body. And on the right, that chart is each type of drug that the college freshmen have experimented with or tried throughout their college career. What other programs prevent drug use and abuse in college students? On-campus drug prevention programs were put in place to prevent the use of drugs and prevent students from experimenting with drugs. Not every program guarantees the prevention of abuse or misuse, but they are there to help educate students on harmful effects of drug use and abuse. Programs were also put in place to educate students on how to prevent drugs amongst their peers. Some of the other programs they have are on-campus counseling services, the U Lifeline program, which helps students who are overwhelmed or struggling mentally in college. The Higher Education Center for Alcohol and Drug Misuse Prevention has a website where students can learn more about preventing substance abuse amongst their peers and gaining more knowledge in that area. So, in what environments does drug use take place? College freshmen are now experiencing their first times going to parties, usually, and hanging out with a bunch of other people that could possibly be experimenting with drugs. So that includes social environment. The drugs tend to be mixed with alcohol and can have dangerous effects. Parties, tailgates, clubs, the stress environment, so the library when students are cramming, or when they just need to take something to focus so they can get all of their work done in a certain amount of time. Or they're self-medicating for anxiety, which is usually with sedatives. And abuse amongst college freshmen. So based on a study done by Addiction Center, a number of factors can influence drug use in college kids. Stress is number one. New college students are unsure how to cope with being thrown into the college experience. Number two is the amount of schoolwork that the student has. So many students abuse prescription drugs to meet deadlines or study for exams, and that fits the example of the social environment or the library. Being on their own and allowed to make their own decisions. Students who have had strict parents in the past and students who want to try new things. So when they're thrown into that environment, they can do what they want without having backlash from their parents. Peer pressure is the fourth, and students who are experiencing party culture or seeing their friends use drugs for the first time, they're more likely to use if their friends are experimenting too.
My name is Sonia Oliveira. We are discussing sedative hypnotics, and I'm leaving off where Bailey left off. She did primary, and I'm doing secondary. So first off, what is secondary level of prevention? Well, if we look at it, it's basically saying that we're going to, someone is already in this process of abusing illicit drugs, abusing drugs, and we need to stop them or convince them to get help before it causes more harm to the body. How do we do that? How do we help someone once they've already started? And there's several different ways. We can look at the signs, paying attention to the college students and when they get distant or moody or when they've changed from what they used to be. We can also look at how do we fight that addiction? And we do that by one-on-one therapy, and you'll see that where you can find a therapist in your area. One-on-one help or even group intervention, which can have a lot of benefits to it. So let's check them out. Real quick, I have found some statistics that I thought were noteworthy for this. In a study done in another small little university, or in a university, we observed what first year and second year sedative use was, and among them, 37% said that they had used sedative hypnotics. Of that, 17% of males and 17% of females, which is weird that it's even, but they all have said that they have encountered and used sedatives. Another statistic which I found really promising was looking at what another university, a small little private university, conducted. They conducted drug use amongst their students, patterns, concerns, and consequences. And of this survey, 262 college students reported using an illicit drug. Of that, 69% reported negative consequences over their lifetime. So it means that they use the drug, and because of it, they have the consequence that they will forever live with. 28% were actually concerned that they had taken it too far. They had misuse and, they were kind of becoming dangerous. And 76% were moderately interested in some help of intervention. So of that 26%, 76 were like, I need help and I need to do something before this gets extremely bad. So I thought this was really a neat statistic. So how do we tell there's a problem when it's beginning? And you can do this many different ways, observing your best friend, if they're just moody all of a sudden or incoherent, you know that there's a problem of misuse. So looking at these signs of, do they have memory loss, loss of muscle control, just looking at all of these specifically to see if they're struggling with something. And you're dizzy and this is getting too out of hand, you notice that there is a problem. So, counseling opportunities. There are many places to get counseling. There's counseling here on campus at CNF Austin. There's counseling everywhere. But to find somewhere where maybe you don't want to speak on campus, or you're biased about it, I'm not sure what the reasons would be, or you need a place to look. These are both really good places where you could find counseling, and it will be super helpful. This first one is kind of more of a type in your area and find counselors within your surrounding, wherever you live, your location. This other one I thought might be a little bit more, if you're too sketchy about that first one, and maybe a little bit more credible, and it comes with a lot more resources and information, even about mental health and other things. This link is a government website and belongs to government organizations, so we're going to take a quick look at it, just to show you what it's like. Best suit your needs and that sort of thing. So that's what those two are about. And this next one, I relate more with group therapy. I don't know, I'm a team player, so I like group things. Group therapy specifically, according to dictionary.com, the medical definition for group therapy is a form of psychotherapy that involves sessions guided by a therapist and attended by several clients who comfort personal problems together. So it's teamwork. You're hearing other people's stories and figuring out how they're going to overcome their obstacles, or maybe potentially seeing that what they're going through is really hard and that what you're going through is doable, that you can beat this. So that's what it is. Some of you still might not really understand what group therapy is, so I have a little video. It's an example. It's about stress anxiety, and it's super good because it gives you an idea of how group therapy works and how it could be very beneficial. So let me play it.
For all of you, and I think, I hope you've learned a lot about your test anxiety, but I'll tell you what, since we're getting ready to sort of bring things to a close for today, I'm going to start with Eric and come around this way. Just briefly, what is one thing that you learned today or that stood out to you about dealing with test anxiety?
I think one of the things that definitely stood out to me was I had to stop telling myself that my work is on the line with every test, and I think that right there is going to help me a lot.
Okay, great. Yeah, that whole idea about how it's coming from what you tell yourself about the test. I mentioned to you all earlier that I learned that idea when I was in my 20s, and it really helped me with a lot of different things. It can certainly help you with test anxiety. Good. Jen?
That's going to take it away. It's just that ability to shut it down, to stop all of that that's going on in my head before I go into the test.
Good. Morgan, how about for you?
So as you can see from that video, it was more of a feedback system. Hearing how one person's going to tackle their problems and how another person tackles them. And it's just a feedback loop on how you can progress and move forward. And it's kind of like you're weighing on each other to do better than what you've done before. So I really enjoyed that video. I hope y'all did too. Let's get on. So what specifically are the benefits to group therapy? And there's so many. And group therapy still might not be for you. Maybe a counselor is better for you. Maybe other programs are better for you. But group therapy is really interesting to me because it has so many benefits. It reduces isolation and enabling members to witness the recovery of others. So I'm witnessing, or you're witnessing, somebody else's recovery and benefit to it. And you want them to do good, and they want you to do good. They all want you to succeed. Groups work because they are suitable for treating problems that commonly accompany substance abuse, such as depression, isolation, and shame. So not only are you tackling your substance abuse, but you're also tackling shame, depression, because you're all somewhat experiencing the same feelings and emotions. Groups provide peer support and pressure to abstain. So it's kind of like a pressure system. I'm watching you do good, you need to do good type thing, and then I'll do good. So you don't want to see each other fail, and you don't want them to see you fail. So you're doing your hardest to succeed for yourself priority, but also for them. Groups allow for a commitment from others to be on time, recognize failure, and be supportive. Even if you do fail, they're still going to be behind your back, supporting you and progressing you to move forward and do better. And that's what I think is really cool about group therapy. So that's the end of my presentation. Thank you so much.
You guys, my name is Paige Richard, and I'm a part of the Sedative Hypnotic group, and I'm going to be covering secondary prevention. Okay, so I'll talk, can sedative hypnotic drug addiction be treated? Can drug addiction be treated? And the answer is yes, but it's not simple. Addiction is actually a disease, and people simply can't just stop using drugs for a few days and all of a sudden be cured. Most patients need long-term care and repeated care to stop using completely and recover their lives. As we know, college is often a time where a lot of people experiment with drugs. And actually, according to Hernandez and Nelson, the most misused prescription drugs amongst college students in the United States are actually tranquilizers and sedatives. Okay, so as soon as an overindulgence and partying takes over and drug abuse slowly becomes a normal for people, their academic performance of up to 25% of students actually burns out. And that, thinking about that, that's actually a pretty high number of people to all of a sudden lose, interest in their studies. So how can we prevent this, or how can we help this if this does happen? Okay, so I'm going to be speaking about today about intensive outpatient treatments. Like I said earlier, this is a secondary level prevention, and these intensive outpatient treatments are attending routine programs with licensed professionals, and the with licensed professionals makes these outpatient programs different from just regular group meetings like AA. Okay, these are led by licensed professionals. And then following, I'm gonna talk about law enforced condition requirements for intensive outpatient programs. Okay, so what is intensive outpatient treatment? Okay, intensive outpatient programs, also called IOPs, are direct services for people with substance disorders or co-occurring mental and substance use disorders who do not require medical detoxification or 24-hour surveillance. Okay, it is the alternative to inpatient or residential treatment, and they are actually designed to establish psychosocial supports and facilitate relapse management and coping strategies. Like I said prior, these are all led by licensed professionals. Okay, so what do they do? How do they operate? IOP services offer a minimum of 9 hours of service per week in three-hour sessions. However, some programs will go about it differently. They might have longer classes and shorter amount of days, or shorter classes and longer amount of days. And as you go on through the program, it becomes less intensive for the patients. All right, and there are specified numbers of hours per week for each individual, and they're going to vary for each individual on how intensive it needs to be or less intensive it needs to be. It all varies on the individuals. So these are going to consist of structured individual sessions, group meeting sessions, or family therapy sessions, as well as psychoeducation about substance use and mental disorders. Okay, so what is psychoeducation? I thought it was necessary to define it so that everybody is aware of the definition of it, because it kind of really does give you an insight into IOPs. Okay, so as defined by Google, psychoeducation is an intervention with systematic and structured knowledge transfer for an illness and its treatment. It integrates emotional and motivational aspects to enable patients to cope with the illness, and it actually improves treatment efficiency. Okay, and IOPs also will differ from other treatments, like inpatient treatments, because they allow the patients to remain in their own homes and in their own communities where they can still continue to go to work, or in our case, for our 18 to 20-year-old college students, they can remain in college, which is a pretty big deal, so they're getting the treatment that they need for their drug addiction while also relearning how to live life through a sober way and being able to continue their education, so they're not having to fully miss that. And so a little bit less weight on your shoulders compared to an inpatient. I feel like they probably have a lot of their weight going into those. Anyways, I digress. Okay, so what are the goals of IOPs? It is to help the individuals learn early stage relapse management and coping strategies. Also, to ensure that the person has psychosocial support, which I should have touched on earlier, but I didn't. Psychosocial support is like your family support, your loved ones support, your friends support, just so that you have some kind of support throughout your treatment. Okay. Another goal for IOPs are to address individual symptoms and needs. Like I told you, each treatment and the hours and intensity of treatment is going to vary per individual. It's not all the same for everybody. And I think that's pretty smart. Not everybody's going through the same thing or needs the same type of treatment. Anyway, so I like that point. Okay. So there's a broad variation across programs in terms of service delivery and intensive outpatient programs. And the way that they determine who needs what is through the intake process, which is going to consist of your screening and assessment. Okay, and there the counselor, or your LCDC, which is substance abuse counselor, chemical dependency counselor, is going to talk with the patients, and they're going to figure out what's going on, why are they here, what are our goals, and they're going to start putting together the treatment plan. Also, after this intake, the counselor will better know what kind of crisis management might be coming up in the future, and best ways to go about resolving those crises. Also, this is where your discharge planning is going to be, touched on and given the idea of what's to come and what we're looking at. Like I said, our goals. And this is also where the intensity and duration of care is going to be established as well. Like I said, once again, it varies from person to person, so it's not always going to be the same. Okay, so how about some statistics? All right, so according to legacytreatment.org, between 85 and 95% of all people who successfully complete drug rehab report still being sober from all drugs 9 months after discharge. That's pretty impressive, you know, if you've ever known anyone who's struggled in addiction, that's pretty impressive. Roughly 80% of patients report benefiting from an improved quality of life after attending an IOP. An estimated 43% of people who go to drug rehab successfully complete their treatment, and another 16% actually transfer to other rehab centers for additional treatment, which is awesome, you know, that they're actively continuing their care. Okay, and I did include this because it's not all roses everywhere with everything. This is life. So between 40 and 60% of people who suffer from drug use disorders end up relapsing when treatment is discontinued. However, these relapse rates are significantly lower than those for other chronic diseases such as hypertension and asthma. Okay, so I included this in there because for the addicted individual, relapse does not mean failure. You know, it often happens. So that doesn't mean, oh, it's just over and that's the end of the road. No, it just means that they need further treatment or they need a different type of treatment, stuff like that. So that's not like a complete failure number or anything like that. This is just the realities, you know, of drug addiction. It's hard. It's not easy. And like I said earlier, it's continuous throughout life. Okay, so I said earlier I was going to touch on some law enforcement court-ordered treatment. Well, right here I put a poster that says it's estimated 80% of all offenses that lead to jail in the United States stem from drug or alcohol abuse. That is a big number. Okay, and especially if you're looking at college students, you know, hey, you know, we're at that time in our life we're kind of wild and crazy, you know, starting off until you get to grips, you know what I mean? So it's not that far of a stretch that this would tie into our age group. Anyways, okay, so often the criminal justice system can apply legal pressure to encourage offenders to participate in drug abuse treatment, or treatment can be mandated through a drug court as a condition of pretrial release, probation, or parole. Okay, like I said, these are the law enforcement court-ordered treatments. All right, so a large percentage of those admitted to drug abuse treatment cite legal pressure as an important reason for seeking treatment. And actually, you know, some positives here, you know, even though you're in the legal system, but, you know, if you have a drug abuse problem, here's some positives that most studies suggest that the outcome for those who are legally pressured to enter treatment are as good or better than the outcomes for those who enter treatment without legal pressure. Also, individuals under legal pressure also tend to have higher attendance rates and remain in treatment for longer periods, which can also have a positive impact on treatment outcomes. So, silver lining, right? It's helpful. I think it's great. Instead of just, you know, locking people up in jail and never having anything to do, never helping them, you know. So anyways, the requirements of the courts can be intensive outpatient programs, but actually we're seeing an increase in court-mandated drug court programs. All right, so what is drug court? Drug courts are specialized court docket programs that target criminal defendants and offenders, juvenile offenders, and or parents with pending child welfare cases who have alcohol and other drug dependency problems. Drug courts are often overseen by the judge, and the process is usually guided through a model called the drug court model. All right, so the drug court model will consist of the offender screening and assessment of risk, needs, and responsivity. Okay, so this is your intake, like we talked about earlier, where your intake officer, probation officer, your counselor, whoever it is, the judge, will be gathering information to try to figure out what needs to be done, what's the goals, the treatments, you know, like we discussed earlier. Okay, so following will be judicial interaction, which I said earlier. This means that it's often overseen by a judge. You're going to go in and meet with the judge at least monthly, face to face. You've got to check in, and then you're going to be monitored. There's drug testing, and supervision is often a requirement as well, because a lot of these people, like I said, this is a drug court, so most of these people are on probation or parole. They have child welfare cases pending. They're in the court system, so there's monitoring and supervision pretty heavily. Another good thing about the drug court model is that they do make sure to give incentives as the people grow and they're doing good. They will have graduation sanctions, incentives. They have graduation ceremonies, things like this, little coins, tokens that they give, to give these people, I don't mean to say these people, to give participants a sense of accomplishment. You know what I mean? Okay, and then there are treatment and rehabilitation services. So this could be, if the patient decides that they need more intensive treatment, they can go to a request from the judge to go to like an inpatient program, or if they just want more treatment and in a less intensive setting, less intensive than an inpatient treatment. In addition to their drug courts, they can go to like AA or something like that, like with the group sessions that Sonia went over. Okay, so some statistics for drug court. All right, an analyst of research findings from 76 drug courts found a 10% reduction in rearrest, which is pretty big, right? Any reduction in rearrest is showing that we're doing something right. Okay, and then another statistic is that a meta-analysis of 57 studies estimate that participation in drug court program would produce an 8% decline in crime relative to no treatment. Okay, so like we're saying before, graduates of drug courts are less likely to be rearrested than persons processed through traditional court. Like I said earlier, drug court for a drug dependent person versus just sitting in the jail and washing your hands and just, hey, that's their problem, right? Okay, so obviously it's beneficial. Also, finding from drug court evaluations show that participation in drug court results in fewer arrests and convictions or longer periods between arrests. So obviously it's working, right? It's a good job. I like it. If you want to do more research to look into it, it's pretty.
Hello, I'm Alexandria Newsom. I will be doing the tri-tier prevention of this presentation. So during this level of intervention, our main objective is reducing the after effects of addiction/disease to decrease the results of possible disability or any suffering inherited by disease/addiction. It is important to understand that prevention at this point is inevitable because the abuse has already affected the person's health. What are the after effects of sedative hypnotics disease/addiction? Well, first, what are after effects? After effects is a delayed effect that follows after a stimulus has been removed for a long period of time. And this stimulus can vary from drug use, alcohol use, or from drugs used for medicinal purposes. Secondly, what are some after effects of sedative hypnotic addiction? Well, some symptoms can include, but are not limited to, anxiety, insomnia, partial hypotension, nausea, vomiting, tremor development, incoordination, restlessness, blurred vision, sweating, hypoxia, anorexia, seizures, and delirium. And as you can see in the visual, there's benzodiazepines. The commonly used are Xanax, Klonopin, Valium, Ativan, Ambien, and they also show like emergency room visits, sign of abuse, and withdrawal timeline. Why you should be concerned, why you should stop, and why it's hurting you, and why recovery is needed. Well, sedative hypnotics can have major health risks after use for a period of time, and this period of time can be short-term or long-term. It can still be detrimental to your physical, mental, and emotional health. And as you can see in this visual, I have Ambien abuse, which shows some long-term effects. I have symptoms of Bizonapine withdrawals, which can cause seizures and muscle spasms, and depressant's long-term effects as well.
Entering a detox, you might experience the following withdrawal symptoms: anxiety, panic attacks, rapid heart rate, muscle spasms, body tremors, hallucinations, and depression. After the physical detox, somebody will need to enter a treatment facility or some recovery program to stabilize and put the disease into remission. There needs to be a holistic approach to these interventions. This can consist of clinical pieces, physical pieces, counseling, writing therapy, process groups. Physical interventions can consist of yoga to help regulate, stay in the moment, especially during the onset of a panic attack, intense physical activity to get brain functioning normalized, and of course, just a solid peer group to help encourage and reinforce your own sobriety. I hope that you guys found this video educational and informative. Benzo use is no joke. There's people out there that are affected. There's people out there that are dying. We're here to help. So if you are suffering from benzo addiction or any kind of addiction, or if you have a loved one who suffers from the disease of addiction, please give us a call. We're here to help. We offer a variety of interventions that will help somebody stabilize and get them on a path of healing. If you like this video, please check out.
So one of the rehabilitation programs I found was American Addiction Centers, which is a rehabilitation program that was founded in 2007. We have expanded to programs that are in California, Florida, Texas, Nevada, Mississippi, New Jersey, and Rhode Island. What do they offer? They offer a full continuum of care from detox, residential, partial hospitalization, intensive outpatient, and telehealth. They also offer all levels of care and treatments based on your specific needs. They do also have a million groups, which is amazing, from 12-step groups to trauma groups to first responder groups, LGBTQ groups, anger management groups, cognitive behavioral therapy groups, and also many others. What is the process? Intervention is the first step, which allows them to have an interventionist conduct a pre-assessment in order to understand what your loved one's history and behavioral health issues have been in order to find the right treatment for them. Treatment process entitles rehab, which can last up to 5 to 10 days, detox, which can last up to 5 to 7 days, recovery, and a setting schedule. The next rehabilitation program I found was Bright Life Recovery, and they are also offered in Texas as well. Who are they? Bright Life focuses on what people can do and rather what they can't do, and they also strive to teach people and take care of themselves after addiction recovery. And they also offer occupational therapy and workplace and guidance after their program, which is amazing. What do they offer? They also offer a one-on-one approach, and they also have individual therapy, which can give the patients and tools the strength to survive addiction and rebuild their lives after the program. There's also a 24-hour nursing care, doctors, fully licensed and certified therapists to work with throughout the program. What is the process? Your treatment program is chosen after a recovery specialist to discuss your concerns and provide you with an overview of what to expect at Bright Life. You'll also have a scheduled tour of the selected facility at your location or whichever location you go to. A decision is said by the person, and then they will pursue a treatment. Your admissions team is of counselors, therapists, and medical professionals who also creates a customized plan that can treat your every specific addiction, any individual's needs. So what are some local rehabilitation programs in Houston or Texas as a state? Well, there's J. Flowers Health Institute, and their price range from $44,000 to $129,000 with government assistance for eligible candidates. The Orchid Umbrazos, which is in Wallace, Texas, and their price range is $30,000 to $40,000 monthly with assistance by insurance. The next one is Origins Recovery Center, which is in South Padre Island and is only for men, and the price is $31,000. The fourth one is Willow Springs Recovery, which is in Bastrop, Texas, and the price range is $17,500 to $19,500 monthly with government and insurance assistance. Ripple Ranch, which is in Spring Branch, Texas, and their price range is $18,000 to $24,000 for 30 days. Assistance was not verified, but I'm pretty sure they have some. These are just our references throughout the whole presentation. I hope you enjoyed our sedative hypnotics, and I hope it was very informative. Have a good day.